In an emergency, you know you want to help, but nothing's more terrifying than wanting to help but not having a plan. Training's going to give you that plan. My name's Mike Schertz. I'm a board-certified emergency medicine physician with over 20 years in that job. I have 20 years of experience as a medical director for fire departments, EMS services, and a tactical medical program. Prior to that, I spent 13 years as a special forces medic. Schools have been conducting fire drills for decades. But when's the last time a kid actually died in a school fire? It was 1958. That doesn't mean fire drills are useless. If anything, it demonstrates that they're working. Training gives you a plan. The airline safety industry doesn't conduct safety briefings because they're expecting a plane to go down. But if there is an emergency, they want you to know what to do. It's the wrong time to discuss it with just-in-time instructions. You need to know the plan ahead of time. Fire extinguishers are ubiquitous in homes, offices, and public spaces. Why? We have a fire department. They can respond, they can put the fire out, but it's going to take them time to get there. If you have a fire extinguisher, maybe you can put the fire out before they get there. Maybe you can at least decrease the likelihood of loss of life or loss of property. In an active shooter event, law enforcement's going to respond about 4 minutes after the first 911 call. But when they show up, they're not going to be treating casualties. Their job is to secure the scene and keep everybody safe. EMS in our urban area is going to show up in about 7 to 8 minutes. They may not be able to immediately come in, depending on how comfortable they are with law enforcement's control of the scene. In rural environments, it could be 12 to 14 minutes. Any care your casualty gets in that first 10 minutes of one of these events is going to have to come from active bystanders. That's the term the federal government uses for individuals that are present at these events but uninjured. Unfortunately, we now have to teach people run, hide, fight. But there's another part of that, treat. A casualty with a femoral artery laceration can bleed to death in 5 minutes. The only way they're going to survive this event is if a bystander there provides medical intervention. In this time it's going to take you to watch a Harry Potter movie, you can complete this course, and I can teach you how to manage massive hemorrhage with tourniquets and wound packing, open airways, recognize lethal chest injuries, establish the circulatory status of your casualty, and treat them for hypothermia. These aren't new skills, these are lost skills. In the 1920s, the 1930s, there was no EMS system, and any medical care you got after an injury, it came from your family or your friends. Somewhere along the line, we've civilized ourselves into believing we don't need to know how to take care of ourselves, and that's wrong. Hopefully you already have a first aid kit, but if you really look at that kit, what kind of injuries is that kit prepared to manage? It's probably got Band-Aids for cuts and scrapes. Does it have something that's going to keep someone from bleeding to death from penetrating trauma? That's a trauma kit. It's a separate device. In 2015, the White House launched the Stop the Bleed initiative through the Department of Homeland Security as a community resiliency training program. They want every American to learn hemorrhage control. The Stop the Bleed program is good. It trains people how to do hemorrhage control, but there are other causes of preventable death in trauma patients that we can manage pre-hospital. The Essentials course goes beyond Stop the Bleed. We cover everything they cover in that material, plus we're going to talk about other causes of preventable death and how to manage those. Everything we're going to cover is consistent with the Committee for Tactical Emergency Casualty Care's Active Bystander Guidelines, plus the Department of Defense's Tactical Combat Casualty Care Guidelines for all combatants, as well as go beyond the all service members TCCC guideline. Unfortunately, to teach you this material, I have to show you some ugly photos. I have to show you photos of people that have been shot, stabbed, and blown up. I'm not doing that for dramatic effect. The first time you see one of these injury patterns shouldn't be on a parishioner in your church that was shot. It shouldn't be on your spouse during a botched 7-Eleven robbery. It shouldn't be on a school child in your classroom. You should see these things in training. That's what training's for.